Today we're going to talk about a very important topic. What should you do to avoid having a stroke? Actually, this is very important. The thing is, if you look at diseases, it's a bit cynical, but I say there are good diseases and there are diseases, bad ones. Good diseases are those where a person just gets sick, collapses, dies, and that's it. And that's it. It's over. He's dead, he's gone, and he doesn't torment anyone anymore, neither himself nor others. But in many cases, there are diseases that I call bad diseases. Bad diseases are those that don't kill a person, but make them disabled, unable to take care of themselves. And I think that's even worse than death. It's better to die than to be left disabled. And then for many years to suffer in diapers and burden other people who have to take care of you. And a stroke, that's exactly the kind of illness that often doesn't kill a person, but deprives them of the ability to take care of themselves. And because of that, it's a terrifying condition for a person. Today, let's talk about strokes. A stroke is a disruption of blood flow to the brain, but there are two types of disruptions, either slow chronic disruption, that's called dyscirculatory encephalopathy, or as I like to say, the brain dries out. When blood gradually, chronically gets to the brain worse and worse, and the brain slowly dries out, disrupting a wide variety of brain functions in a person. But this happens gradually, goes unnoticed by the person, and can only be noticed if you look over the course of several years. But an acute disruption of blood flow to the brain is what is called a stroke. That's when it happens right now. Suddenly, that's it. And immediately, we see some neurological symptoms of a stroke. There are two types. The first is hemorrhagic. This is a brain hemorrhage. When a blood vessel bursts, blood floods the brain, and the person suffers from this hemorrhage. Well, usually this causes such major health problems that many people die from hemorrhagic strokes. Those who do survive mostly remain severely, deeply disabled. And it's hard, very hard to solve this problem afterwards. On the other hand, besides hemorrhagic, there is also ischemic stroke. This is a disturbance of cerebral circulation in which blood does not reach a certain area of the brain for an extended period of time. Well, it could be a thrombus blocking the vessel, or an embolus of some kind, or a spasm of the vessels, or due to prolonged hypertension, atherosclerosis, or various other causes. But the blood does not reach the brain to the nerve cells, and these cells are very energy demanding, meaning they constantly need blood supply, they need glucose to be delivered, they need this to survive and to function. And if the brain cells are left without blood supply for a long period of time, it leads to serious trouble because these cells first stop functioning, which manifests as microstrokes. Or they die completely, resulting in an ischemic stroke. A region forms in the brain where blood has not been supplied for some time, and the nerve cells in that area have died, have been destroyed, they no longer function. And usually on the opposite side, most often the arm and leg are paralyzed. There is no sensation there. The face may be distorted. In other words, the typical standard symptoms of an ischemic stroke. And when I talk about stroke, I always say that a stroke is not a disease. It's an event, meaning that if it has already happened, you can't turn it back. It's already occurred. It's like a car accident. Once it has happened, you can't undo it, but you can try to restore the lost functions as much as possible. Also, after a stroke, when it has already happened and the arm or leg is paralyzed and brain cells have died, we can try to make it so that neighboring cells take over the function of their lost brother. To do this, we need to improve blood supply to the brain and use electrical impulses on the arm and leg. And this is not called treatment, but rehabilitation, recovery after a stroke. And sometimes this allows us to achieve certain results. For some people, the results are less significant, for others, more. But this is no longer treatment, it's recovery. Recovery of functions lost after a stroke. And today we're going to talk about something a little different. What needs to be done so that a stroke doesn't happen at all? After all, it's much more important to prevent a disease than to treat it well. Today we'll talk about what I can offer you. 3 factors you need to address to prevent a stroke. So let's get started. The first factor, to avoid having a stroke, you need to have good hydration of the nervous system, meaning that your nerve cells are well saturated with fluid, with water. For this, a person needs to drink a sufficient amount of water, enough for their body. I call this biologically acceptable. at the very least, a minimum. This is the amount of water our body needs in order to function properly. And the biologically acceptable minimum water intake is approximately, well, roughly speaking, 1 liter of water per 30 kilograms of body weight. This number should stay exactly like that. If you weigh 60 kilograms, that's 2 liters of water to drink. If you weigh 90 kilograms, you need to drink 3 liters of water. And that's the minimum. You shouldn't go below that. And if a person drinks too little water, that's when the brain becomes insufficiently hydrated, which in turn creates a predisposition to developing either chronic or even acute cerebrovascular disorders. That's why drinking water is the first and most important factor in preventing strokes. And if people neglect this factor, they may actually bring themselves closer to that condition. And I want to point out that when I talk about drinking water, I mean specifically water, not just any beverages, tea, coffee, soup, or some kind of infusions, but specifically water that you drink. This makes a huge difference. All these drinks are actually part of a person's food intake. They go through the digestive system and are digested like food. But water is a factor that gets absorbed in the stomach, and it's the very thing the brain needs to prevent disturbances in cerebral circulation. The second factor needed to prevent a stroke is to ensure the patency of the vessels through which blood reaches the brain. Blood reaches our brain through only 4 vessels. 2 carotid arteries, the internal carotid arteries, and 2 vertebral arteries. And the biggest problem in our vessels is that they can become compressed or pinched due to an incorrect neck position. I'm talking about the fact that people like to sleep in the wrong position on the wrong kind of bed. The wrong position is sleeping on your side, or God forbid, on your stomach. And the wrong kind of bed is a soft, uncomfortable bed. On a soft orthopedic mattress that takes the shape of your body, which is crooked to begin with. That's why if a person happens to sleep on their side or on their stomach, their blood vessels in the head can become bent or compressed. And as a result, less blood is able to flow to the head. Yes, in this state, it's easier to fall asleep because hypoxia of the brain sets in. And with this brain hypoxia, when less blood and less oxygen reach it, the brain shuts down and falls asleep. It's easier to fall asleep. It's easier to fall asleep on your side or on your stomach. But the brain receives poor blood flow, and this creates specific factors that can lead to a stroke. You must not sleep on your side, and you absolutely must not sleep on your stomach. It is precisely because of sleeping on the side and on the stomach that nighttime strokes occur. You should only sleep on your back, just the word back of the days. The word back indicates that normally a person should sleep on their back, only on their back. And only in this position will there be good blood supply to the head. So the second factor to prevent a stroke is to sleep on your back. But people tell me that they can't sleep on their back, they can't fall asleep on their back. In such cases, I always advise that you need to change your bed. That means making your bed as firm as possible. In other words, it's like a board. It's sleeping on a hard surface. And when a person makes their bed as firm as possible, they can't involuntarily turn onto their side during the night. And they will sleep only on their back. There may be a few nights of getting used to it. It might take some time to train yourself to sleep on your back, but only when lying on your back does good blood supply to the head occur. And there is no risk of developing an ischemic stroke. So sleep on a firm surface, sleep on your back, and ideally get rid of all pillows. The higher the pillow, the shorter the life. Throw away your pillows. You don't need them. They will only distort your neck and cause impaired blood flow to your head. And the third factor is the condition of the blood itself. That is, many people have thick blood. For the past 10 years or even more, I have been practicing capillaroscopy. This is a technique where I examine people's capillaries under a microscope and observe them. I can see how blood moves through the capillaries. In other words, the microscope displays the movement of blood through a person's vessels on a TV screen. And I want to tell you that many older people have thick blood. The blood is thick simply because the person is older. In older people, there is a general demagnetization of the body. Because of this demagnetization, blood cells lose the magnetic charge on their surface. The cells start to stick together and the blood becomes more viscous and less fluid. The blood moves, but the red blood cells clump together into conglomerates, and then the blood becomes thicker. And such thick blood does not reach the brain well, especially at night when blood flow slows down, especially if a person sleeps on their side and the blood is thick and viscous. This is a crucial factor that leads to the development of ischemic stroke. And I want to warn you right away, I have examined tens of thousands of people, and not once, not a single time, have I seen people who take blood thinning pills actually get thinner blood from it. The pills that are used, aspirin, cardiomagnil, Magnicor, warfarin, thromboas, and others, do not thin the blood. The blood, when people take these medications, their blood remains thick. That's why people who take these drugs don't actually have fewer strokes or heart attacks. They do not improve a person's blood circulation. They do not improve the aggregate state of the blood. So the medications that are supposedly called blood thinners do not actually thin the blood. So how can you actually thin the blood? Well, to begin with, you need to understand that a person's blood moves because the blood cells have a magnetic charge. They repel each other like charged little balls, which ensures good blood flow. As we age, the magnetic charge weakens and the cells start to stick together. In order for the blood to become thin again, it needs to be magnetized. How does this happen? I magnetize the blood using products made from turmanium ceramic. Just don't confuse it with tourmaline. They're different things. Turmanium ceramic has its own magnetic field. And when I do capillaroscopy and see that the person has thick blood, I apply a product made of turmanium ceramic to their arm. In this case, a turmanium belt. As soon as I place the turmanium ceramic on the arm, it creates a magnetic field. I immediately see a sharp instant change, an acceleration of blood circulation at the cellular level. These conglomerates break apart and the blood starts to flow better. That is, the magnetic field of the turmanium ceramic leads to the magnetization and thinning of the blood. However, it's not for long and not immediately. Sometimes you need to hold it for a little while. But in order for a person's blood to remain consistently thin and magnetized, it is necessary to use turmanium ceramic over a long period of time. And the best way to do this is when a person spends the whole night on a turmanium mat or belt or other products made from turmanium ceramic, sleeping on them all night. And that's why the third factor in preventing a stroke is to sleep all night on turmanium ceramic. Then, throughout the entire night, your blood will remain thin and you won't have a stroke at night. There won't be any disruption of cerebral circulation at all, and your brain will receive good nourishment and blood flow. So these are the three factors. If you want to avoid having a stroke, you need to drink enough water for your body, the right amount. You need to sleep on your back, only on your back, not on your side or stomach. And be sure to use a turmanium mat for sleeping. This turmanium mat will ensure a good condition, a good rheological state of your blood. And then you can effectively prevent cerebrovascular disorders. And make sure that a person does not have a stroke.